But just to welcome you all, I'm Michelle Pierce. I am your outgoing transformation lead for the Middlesex London Primary Care Network. Melissa Linsman has returned from her maternity leave, and she will be here for following up for our next webinars and events from the MLPCN. And this is a follow-up webinar from our conference, which was last Wednesday. And it was a huge success, and we're just really thrilled that Dr. Marrone has offered us this follow-up time, because there was a lot of interest, a lot of great response and questions, and we wanted to give you just a little bit more. Housekeeping before we begin this is to make sure that you're on mute if you're not speaking. We have a lot of questions that were submitted in advance, so we're pretty tight for time for that. But if you do have any other questions, I suggest you put them in the chat for us. And then maybe, hopefully we can follow up if your question is not answered in today's session. If you are signed in as iPhone or you don't see your own name on your screen, please make sure that you rename yourself if you're a physician and you want to receive your main pro credit for this session. And if you have not confirmed your MLPCN membership, please do so. We are your voice, and this is sort of by primary care for primary care. You can find information about that on our website. And there are many benefits to you for confirming your membership. If you don't confirm your membership, then even though we are speaking on behalf of all of primary care regardless, we don't know who you are, we don't know how to engage you, and we also are interested to know what your interests are of getting involved and helping to support the change that we're trying to make happen both locally and provincially. So make sure that you do that. And here are the learning objectives for today's session: to identify practical strategies to integrate lifestyle medicine principles within brief clinical encounters by prioritizing the high impact, bang for your buck, as Amanda calls them, interventions, and leveraging interprofessional team supports, applying evidence-based motivational interviewing and behavior change techniques, which she spoke about at the symposium, and to explore accessible evidence-based resources and implementation tools, which is one of the other things there wasn't time for at last week's symposium that she wanted to go over today. We are affiliated with the Thames Valley Family Health Team as the transfer payment agency and the MLOHT for administrative and logistical support. And Dr. Marrone has made the following disclosures she received a non-area from the MLPCN for her symposium speaking, which included this webinar, and is involved in a new endeavor called Optimal You that is under development. So with that, it's my pleasure, for those of you that didn't have the pleasure of meeting her, to introduce Dr. Amanda Marrone. She is a family physician in the Niagara region with over 20 years of clinical experience and board certification in lifestyle medicine. She's a founding physician of Optimal You, a lifestyle medicine clinic that will be launching in the Greater Toronto area, and serves as an educator and a speaker on the integration of evidence-based lifestyle medicine into primary care. Dr. Marrone is a passionate person. I can attest to that. She's passionate about empowering both patients and clinicians to make sustainable health behavior change through practical and science-based approaches. So welcome. It is our absolute pleasure to have you here, and we look forward. I'm just going to stop sharing my screen now so that we can see all of the faces once again and let you drive your own presentation, Amanda. Thank you.
Thanks, Michelle. Thanks to all of you who are taking time out of your, I suspect it's your lunch hour, wherever you are. I just really appreciate you spending the time. And I'm going to try to get as much information I can in the hour as we can. So I'm just going to plow ahead. I am going to share my screen. Nobody judge my desktop. It's messy. I think this is it here, except, there we go. Whew. Okay. Before I begin any session, I am situated in the Niagara region. So where I am presenting from right now, I just want to take a moment of gratitude for the traditional land upon which we have the blessing to practice. Well, I have the privilege of practicing medicine and learning with and from my colleagues. We are situated in the traditional territory of the Haudenosaunee and Anishinaabe nations. And it's whenever I give a talk about lifestyle medicine from this traditional territory, I just feel a connection, because for anyone who knows anything about Indigenous ways of healing, not that I'm an expert by any means, whenever I've come in contact with the information and learned about it, there's a lot of parallels to lifestyle medicine, who value the not only the health of the whole person, but also the environment. So I just wanted to take a moment to honor that. We already talked about my disclosures. Just so you know, I have none really to declare other than the honorarium I'm receiving. Our learning objectives were already discussed. I'm going to put number 3 that Michelle presented to number 1, just because I think that's a really critical piece that I wanted to share in terms of what are the resources that got me informed, that I took, what are the steps I took, and then also where can you go, not just to get yourself informed, but if you're looking for quick patient handouts, this is the session I'm going to show you. So, and then I'll get to as many questions that were submitted. These slides, I've prepared answers. I've also curated answers to all the questions that were submitted. They're not super detailed, but they kind of give nuggets. That'll all be sent to Michelle, who will send it out to you. So even if we don't cover all the things that were included in terms of the questions pre-existing when I came into this, we will get, I'll get that information out to you as best as I can. So I am going to escape from my presentation for a moment, continue sharing my screen, and start to look at, okay, so if you're looking for ways to get informed, resources, websites, I'm going to show you some of my favorites where I journeyed through. And these are all based on evidence. And that's important, because if you just Google things, you could get into some hot water. So the first and biggest one I want to share with you is the ACLM. The American College of Lifestyle Medicine. This is where I got the board certification. It's lifestylemedicine.org. I think there's a slide. My last slide will have the actual website. It's also in the handout, like barrage of handouts that I sent to you. I think that one's entitled Getting Vegucated. It lists a whole list, and all of these websites are on that handout I previously gave to you. So this is what the website looks like. And I'm just going to minimize myself here so I don't see myself. Okay. So here, if you're in and you're not a member, if you're a member, you go to my profile. You can all see my arrows, right, where I'm pointing. But if you're not a member and you're new to this, go to I am a and go to clinician. So when you go to clinician, hopefully you're still seeing all this. You'll see lifestyle medicine, for clinicians, you go down. First of all, you can download a free guide. It's getting started in lifestyle medicine. It's a toolkit you can get for free. And it gives you some actionable strategies in addition to what I've already shared with you in my symposium. So that's a good place. If you don't mind giving your email, they'll send it to you, and it's free. And then if you keep going down here, past all the way, you'll get to this piece. So there's 2 pieces I wanted to make you aware of. Well, 3. The third one is very quick. You can become certified. If you want to go through and become board certified, there's a whole process. It's quite extensive, but this tab will show you how to do that and the steps you need to take. But for your intents and purposes, if you want to get yourself more informed, you go to take a course here under education. So if you click on this, it will take you to the hub of courses. And so the biggest one here is this I am the foundations of lifestyle. If you're planning to get certified, this is like a must. You must do this. This goes over all the pillars, all the evidence. It includes motivational interviewing strategies. It's very intense, 30 hours of CME, which you can claim in Canada. So you can start that process. You don't need to do that, but that's a place if you really want to get into this. That's where I got really, really into the weeds on lifestyle medicine. But if you wanted to explore the full course catalog, you'll see here a list of courses. Now, the membership, so I don't know how many of these, because now I'm signed in, I'm logged in under me and I'm a member. I don't know which of these courses, if any, are free for non-members. I do want to say, not that it's necessary to be a member, but if you were to be a member, it's $250 US, and it is probably the best money you can spend in terms of your access to things. And these, if you were becoming a member, what I would suggest is you go to free for members, this tab right here, and look at the programs that are offered. Like Ready, you have a culinary medicine curriculum, which you can actually, it's a curriculum you can actually introduce to any affiliated medical school or university. So you could teach medical students from this curriculum. It basically shows you how to cook in a healthy way. So it's really good, and it ties in all the science behind the food recommendations. There's also a lifestyle medicine 101 curriculum, which is kind of a mini course of that big course I talked about. That is a very, very good course. And the other thing I wanted to highlight, if you're planning to do those group shared medical appointments that I spoke about, and you're not sure how to lead one, it is one of the questions that came up. So I'm going to kind of answer that question right now since I'm here. A great way to structure, again, remembering that you have to follow the OHIP billing guides around only certain diagnoses. The patients all have to have the same diagnosis in your group. Okay, it has to be more than 2 people. But a way you can structure that group is you bring people, if you have a meeting space in your office, ideally with a screen. If you are a member, you have access to these shared medical appointment pillar videos. They are videos on each pillar, plus an introduction one, plus a where do we go from here video. They're anywhere from about 7 minutes to 10 minutes long, and they introduce the pillar and go over the importance of that pillar. So a way you could structure, perhaps, is showing the video to your patients about the pillar of the day, and then opening the floor to questions, because questions will start to arise. That's where it does help for you to have the background information. I wouldn't suggest doing this like without any further education on your part, but this is where questions can come, and you start to generate questions. And believe me, the time will go quickly if you're doing it for an hour. Or you could lead, if say you're doing one on stress management, then perhaps you could bring in your social worker if you have access and lead a mindfulness, stress reduction session for your patients so they can actually practice mindfulness. Or you could tie in a dietitian if you have a dietitian to talk about, let's do some healthy meal planning strategies. So a way to structure these shared medical appointment videos could help you structure it that way. So there's also a whole lot of other free courses. And then there's also courses that even if you're a member, you can pay additional fees at a discounted rate as well. If you're not a member, you can also, by the way, access those videos. You just have to pay $240 American just to have the videos. But in my mind, if you're going to do that for the videos, you may as well just get access to everything and pay the same amount for a membership. I have no affiliations, and I'm not here to plug getting a membership for ACLM. It's just one of the strategies you can use. So that's courses. If we go back and get out of, oops, hang on. I'm trying to see my screen here. How do I get rid of, Dahlia, how do I get rid of the bar that's asking me if I want to share? It's kind of blocking me from getting onto my tabs.
I think if you hold it, you can
If I
move
hold
it.
it and move it, oh, good, I can move it. Okay. So going back to this, remember we were talking about where the courses were here, right? We'll go back. And so that was courses. And now the other one is resources. So this is one where the ACLM offers a whole lot of complimentary as well as member only resources for your patients. So first off, you've got your 6 pillar resources here. And these are basically one-off handouts you can print off. They're complimentary. They have them also in French, often in Spanish as well. So if I click on this, this is what they look like. And they're very colorful. So you can, if you have access to email to your patients, you could email them, but there's one for each pillar. So you've got these all in the 6 pillars. The other tab I would recommend is the survey and assessment tools. I don't know if these are member only because again, I'm logged in as a member, so I don't know what would have been available to me otherwise. But if you wanted to do like here, this one is very valuable. And I'm also willing to actually like send this to you if you don't have access as a free member, but this actually gives you a way to, your patient could fill it out perhaps in either after a visit when you've talked a bit about introducing lifestyle factors, then you can have a see as to where they're at, or you get them to fill it out and say, now we're going to come back and talk about it, where you can book a longer visit with them. You can get them to fill it out before the visit as well. So you can get a sense of the 6 pillars, and it just goes through the 6 pillars in very simple, quick answer questions. They have a bunch of different assessment tools that way. They have one on nutrition as well. So that is a lot of the assessment tools. Like they have also recommended like sleep checklists. So say you're saying, okay, we're going to work on your sleep pillar. They have a whole list of ACLM pillar checklists. So let's go to physical activity checklist. You print this off, and then these are things that your patient can look at and say, oh, I like pickleball. I could try that. And they can try different activities, ways to incorporate more activity in their day as ideas, if they're looking for ideas. And then go back to here. Nope, I don't want this one. That's surveys and assessments. If we go back, the last tab is this service line specialty resources. This is also, again, I'm assuming that they're complementary, but they might not be. But here they have specific conditions with specific recommendations for the condition. So here's one on overactive bladder. Here's one on preventing and treating diabetes. And there are multiple pages. They're like 2 or 3 pages. So they're a bit more detailed. Breast cancer reduction. I love this one. This one is, it says it's for cancer, but honestly, you could use it for any chronic disease. It's got like dip your toe in. These are bang for your buck recommendations curated for you. So like these are giving your patients ideas of how you can squeeze depending on where you are in your stage of change. If you want to just dip your toe in, they have a bunch of little micro changes you could make in all the pillars, right? If you want to start to wade in the shallow end where you want to do, your patient wants to do a little bit more than just the bare minimum, these are also, again, more in-depth, but not too in-deep ideas. And then you've got dive all the way in. Then you're going for all the targets that you're going. And you would work your way up with the patient. But I love, love, love this handout. And I can also like make PDFs of this and just send them. Maybe I'll just do that because I just think this one's really, really valuable for you if you don't have a lot of time, but you want to give your patients some ideas. So Michelle, can you write that down and make sure I send these 3 to all the people so that even if they're not members and it's not free, they can access it. Yeah, so that one tab, I'm sorry, I'm getting kind of lost in all the tabs that I've opened. Here. If we go here, yeah, if you keep going, also another question that came up, and we will talk about in more detail, is about children. How do you have these conversations with parents? How do you incorporate lifestyle medicine to children, for children? All the pillars, they have handouts and ideas and information and tools that you can use with parents. You can hand them to the parents. You can print them off. If the child's experiencing sleep difficulties, they have a whole sleep one, how to make SMART goals. The other thing they have in the handout section, somewhere in there, is a lifestyle prescription pad. So you can actually print off a lifestyle prescription. So I love the ACLM. It is a huge resource for you. I strongly recommend, at the very least, perusing it, at the very greatest, becoming a member if you really want to get into this with your patients and have access to very simple, quick ways to hand. If you want to hand out resources, these are all evidence-based, and often these more in-depth ones actually have a list of the articles and the resources where the information came from. So all evidence-based. So that's the ACLM. I'll tab all out of those. The other one, nutrition facts. I mentioned this one. This is a way that Dr. Larry Schmitz, when he ran his lifestyle medicine groups, he would basically come in and you know, the session that I went in to observe, the patients had already been through the model. So like perhaps what I would do in your case, if you're this is a new group you're working with, whatever pillar you're on, whatever patient, whatever questions come up, you can teach them how to search and get their own information. And this is a great patient-friendly website for them, where they can go and search anything. So, you know, oftentimes people say soy and breast cancer, right? So you type in soy and breast cancer. And when you do that, you get a whole lot of, these are all based on evidence. So when you click on who is soy healthy for breast cancer survivors, there's always a video. And if you've ever heard Dr. Michael Greger speak, he's very entertaining. His voice is very engaging. I'm just gonna click off that. And what I love about this is there's a transcript, so you can actually read what's being said if you don't have time to watch the video. He also has a whole list of the sources. So everything he's talking about has been curated from evidence, and he just summarizes it in these like really short videos. So Dr. Schmidt used to actually show the video and then they would talk about the video. So they just explored different topics around health and lifestyle using this tool itself. So nutritionvax.org, and this is something you could tell your patients too. Like, this is a great website. If you have any questions about a lot about diet, there are some lifestyle, but more about diet. This is the place. Just search whatever your diagnosis is, plus, fiber, whatever you want to search. There's always something that comes up in this website. The other one is this one, the Plantrition Project. And this is, not just about necessarily nutrition. They also focus on some of the other pillars, not as intensely as the ACLM. But here I would be going down to the start guides. So they offer free start guides, and these here, they're downloadable. They have one, a plant-based nutrition quick start guide. These are for clinicians. They have them in Spanish. They also have one, and you can print them for your patients or send them to your patients. They also have one for pediatrics as well. And this looks like an edible garden start guide. So they also have prescription pads themselves, but these are more for, these are for order, like if you want to order printed. So you can get them for free, PDF download. If you wanted to actual order books that you can hand to your patients, you can actually purchase them as well. So this is a great website. They also have a lot of like if you explore this, there's also courses and education that you can also get more educated on for yourself. And if I go back to here at the bottom, they also have under the Plantrition library, just like the ACLM, a very large amount of handouts, including some recipes as well that you can print off around any of the pillars and then give them to your patient, or you can email them to your patient if you don't want to waste your paper. I'm just seeing, if you like podcasts, this is probably my favorite, because this fellow here, he's not a doctor, he's a nutrition scientist, but he takes a very science-based approach without getting like into the two sides. He will bring he's plant-based himself, but he will bring a carnivore person on and talk to them and try to hear what they have to say to find common ground. He's rooted in science, and he talks about all the pillars, and usually with specialists. He had the sleep specialist on many times. He's had mindfulness specialists. So if you like to listen to things and get educated, I highly recommend this podcast. You can get it on any of the podcast websites or apps. Okay, so that's all I wanted to show you. I'm going to show you these websites, and then I'll just go, I'm kind of going to flip around with the questions. One of the questions that came up was around children. And so when it comes to childhood obesity, you want to approach it, and diabetes, for example, you want to approach it with parents, and don't make it about the weight. It's about healthy lifestyle options. And you want to also talk to parents about that it's an environment change, because our kids, the behaviors that we're worried about in our kids are very addictive behaviors. And so we have to work as a family unit. We have to make the environment like amenable to change. And so that's where you want to start with your parents. And you can use some of the resources I pointed to as well. So printing off some resources. And I don't know if you know this, but there are lifestyle trained, board certified pediatricians. And the one I want to mention, again, I have no affiliation with him other than I've known him for many years, is Dr. Rikin Patel. And why I'm mentioning him to you is because even though he's based in Toronto, he is a board certified pediatrician, practiced general peds for many years. His eyes were drawn to the light of lifestyle medicine, and now he's passionate about getting this information to kids, but more so to the parents as well. And he offers virtual appointments. So he's got a full program. He will do assessments. He's treated kids with ADHD. He's got mindfulness strategies. He runs free workshops and webinars for parents all the time. And you can refer to him. There's so referring MDs here. There is a referral form, and you can make a referral to him, even if you're from London, because his assessments are virtual. I haven't talked to him in several months. He just had a new baby himself. He's been a bit busy, but I do wonder if at some point, if he needed to do a physical exam, if he could partner, say, with yourself, doing the visit in a video conference to do a physical assessment. That might help him, like almost like a telehealth. I'm not saying he does that. I'm just wondering if that might be something he could do for patients who can't get to Toronto if he needs to see them in person. But he can do a whole lot of lifestyle counseling between himself and his team And it's OHIP covered because he's OHIP covered. I'm not sure if his dietitian is OHIP covered per se, or his social worker or a mindfulness coach. Those might be private pay, but definitely his assessment and his information for parents, he has the training to actually have conversations. So my point being, when it comes to childhood obesity, that's a huge topic. You don't have to cover it yourself. That's where we start to branch out to our colleagues who are trained in their specialty in a lifestyle medicine approach. Okay. Also for learners, if you cover learners and you're starting to get excited about this yourself and you have learners, LM Ed, also good for you because you can get education here too. All they have to do and all you have to do is make a free account, and then you have access to all of their, so they have slides that you can actually teach with to your students. They have case studies. You can run through cases of all different chronic diseases using all different pillars. They also have some videos and recorded webinars that you could also use. So LMEd, lifestylemedicineeducation.org, another very good website. And then if lifestyle medicine, the whole point, the whole biggest thing you can do for your patient is actually telling them about it, making the connection between lifestyle and their chronic disease. It is, it is hard when I hear like patients who have, many medications for chronic disease and never, despite all their physician appointments with all their specialists, not one person has ever told them like diet matters. And not to say that's any of you as family doctors, but they never made the connection. So the biggest thing you can do is make the connection for them. And if you don't have the time, and I understand that you're in a very busy situation, especially now in healthcare, then planting the seed, giving them some resources, finding which pillar, for example, giving them the resources on that pillar to start, and then referring them on to people who do this for a living. And ideally, you want to find someone who's OHIP covered so everyone could explore. And so if I don't know if you know about this, but there is a program. It's covered in Ontario, BC, and Alberta. It's called Lifestyle RX. It is only, unfortunately, specifically for type 2 diabetics, but that's could be a large portion of patients in your practice. And it's literally a lifestyle program. So they have content that they read every week, and then they log in with usually an endocrinologist or an internal medicine specialist who will then, so you don't get dinged. They're not family primary care providers. I'm not sure if that rule still applies in the capitation model or not, but the physician will then lead them through like a group discussion about the content from the week before. And people have really responded well to it. They've said it's just been absolutely a phenomenal program. So lifestylerx.io. And the other group that you may have heard about, especially if you've talked to Michelle, because I think she's talked to the Aroga folks, but the Aroga team, they're based out of BC, but they have an office in Brampton now. They have an office in Ottawa. They have offices now cropping up everywhere, a great group where you can actually make a referral for your patient. If you want them to have an internal medicine consult from a lifestyle medicine perspective, they can do virtual consultations. And they have other, like they have registered dietitians, and they have mindfulness, and I think they may even have like a smoking cessation program. Some of those may not be OHIP covered, but the actual consult with an internist. So imagine having a heart disease patient who now is speaking to either a cardiologist or an internal medicine specialist from a lifestyle perspective, in addition to their medications. And hearing that and going into depth with that is another way that offloads you for the time being. But just bringing it up with the patient in the first place and then referring is another way you can try to manage it if you can't do it all yourself. All right. Now that I think I have shown you all the websites I opened, I'm going to go back to my slides and hopefully you can see me. I'm going to pause though. Was that too much? Like, did I go? Is that helpful? I just really wanted to hone this in because I feel like the best place to start is getting the information yourself. Is that all okay? It's hard when I don't.
Sounds great.
Okay. Okay. Hopefully it wasn't I probably took too long on that, but I do feel like it's so important. And like, again, some of this information I already shared is going to tie into the slides that the questions I'm going to go through.
There's 30 minutes left in your time.
Oh, then that's great. I haven't paid it. I just feel like I've been talking for a long time. So, all right. Question 1 that came up. Okay. That allowed me to take a sip because you said I had 30 minutes. Okay. Question 1 was, there were a few questions. It's not just one question. A few questions around like typical, what we just kind of mentioned, strategies to incorporate into a busy practice. How can I get more informed? Hopefully that all tied in, and share more patient resources. Hopefully that tied in. So basically in a busy practice, I'd been there, and it's a struggle. I'm not going to lie, but it can still be done in very meaningful ways for your patient. So, and really remember, like, I don't know what the stat is. Do you remember the stat? Like they taught us this somewhere in my training, like only a very small percentage of what you actually talk to your patients about actually gets absorbed. So having a really long conversation, especially if the patient's not ready for it, it's not going to go over, it's not going to be absorbed much anyways. So you want to use kind of very brief advice about, you know, the 6 pillars. You can show the handout of the 6 pillars, introduce them to the idea of like, do you understand, like, my job, and I say this to patients all the time, like, my job is to offer you all treatments. And I need you to understand, even though we don't talk about it too much, and we're, you know, you think about pills with us, lifestyle, what you do in your day-to-day life actually matters 80% of the time. I don't know if you know this. And I tell them that, and they're like, even if they don't respond like, whoa, I didn't know, you've said it to them and your words matter to them. So saying it, making it very clear, this is a first line treatment. This can be as effective in many cases as your medications. This doesn't replace your medications at this time, but if you start to actually initiate them, we might be able to make adjustments in your medications. But you have to kind of decide what works for you and how much you're willing to change. And I would start with just one goal, one thing that always works. That's always worked for me. What one thing are you, when you look at your day-to-day life, that you wish you could do differently, or you feel like might be impacting? Because they often know, and they'll tell you where they want to start. You can also do pre-visit screens, like those ACLM screening tools. You could do that before. ACLM, like I said, has questionnaires. And then I mentioned this already, like, and if you can't have intensive conversations, plant the seed and say, listen, like, would you be open to seeing a specialist whose job is to, their training is in how to, you know, tackle your specific chronic disease, you know, with a lifestyle approach in addition to your medications. I always make that clear. I'm like, this is not an invitation to stop your pills. This is an invitation for you to make some changes. Let's see where this goes. And once we see things changing, then we readjust and we adjust and we take, you know, we keep in contact that way. So that's hopefully answers that question. Maybe a little too long, but that was a big question, and multiple questions came up along that lines. Next. Okay, question 2. What about when your patient wants to work on everything? Or they say, well, what do you think, doc? What should I work on, right? Again, I'm going to kind of reiterate myself. Start small. I know they want to work on everything, and say, I am so, and validate. I'm so excited that you find this, like, this motivating for you. But in my experience, that word works well, even if you don't have the experience just yet. In my experience, when we do one thing at a time, it builds a lot better. And it makes you, especially if you're new to this, it's kind of like, and I love using analogies with patients. It's kind of like, if you wanted to run a marathon, would you just like not train at all and show up with your running shoes on and try to run it? What would happen? It would be very overwhelming and you'd probably crash. So in the same way, when you're initiating lifestyle changes, we got to do it small, right? Little things, because just like training every day for a marathon, you get better and better and better and more confident, and it becomes easier and not so overwhelming. And then of course, the bang for your buck defaults, you know, are like, you know, when it comes to food, like just go back to the bang for your buck slides, right? Like on processing your diet, like that's a huge one. And then not just on processing it, giving them some recipes to substitute, because if you just tell them to unprocess, it's extremely hard when they're addicted. And it's no wonder they're addicted, because the foods are chemically formulated to addict them. So try to teach them, again, handing them some recipes, have some recipes that you've tried and you know are good, and you can speak to how good they are, would go a long way. The one small thing I've already mentioned. And then if they're asking you to choose, you kind of want to, I always just say, like, I try to avoid choosing for them, to be honest with you. I'm like, when I talk about the 6, which one kind of speaks the most to you? Like, which one are you most compelled to address? It doesn't really, and tell them they're all important. So it really doesn't matter where you start. What matters is which one are you wanting to start, or can you start? That's the most important. So kind of avoid, just like when they ask you, like, what would you do if it was your daughter? Like, you don't try to answer that question in a very specific way for them, because then they may not follow through. Next question. How do you respond? This is a question. I love this question because it happens. Doc, I just want a pill. You know, okay. Like, thank God we have conventional medicine. It's okay. Always respect their autonomy. Like, it's always their choice. But this should never, I don't want to should on you. We don't want this to distract from our duty to offer all options. And now we know better, we got to do better. So if we know that lifestyle is an option, we just at the very least have to mention this is really important. And I tell them this. I say, like, it's always your choice, but I'm not doing my job as your healthcare provider without offering you all treatments. So yes, you want a pill, but I just want you to know, you need to know this. Medications manage your disease. Lifestyle will make your meds work better. Always. Like 100% of the time, your meds will work better with least dose if you actually make the lifestyle changes. And when you say that, even if they're not ready at that moment, they're thinking about it. They will think about it. And then I like to use analogies. Like I said, one of my favorites is, like, I often ask my patients, depending on the patient, I usually ask patients I know are probably doing this. I'm like, do you invest money? Like, do you protect your financial future? Like, do you put away money? Do you invest? And they're like, oh yeah. And I'm like, right. I said, so let's think about what an investment is. It's putting money now in the present, even though it's a bit uncomfortable to do so, even though it takes a bit of planning and it takes a little work and it's not always easy in the present, not to enjoy it now, but to enjoy it when? Down the road, right? Down the road, right? And what happens, like, some people put a whole bunch of money in at once, and that's great when it works, because, you know, it's great. But what is also important is investing early and a little bit every day, right? A little bit every month on a regular basis, because what happens? It compounds. And then I say, you know what? Your health is your best investment. Because I promise you, and I say this, you can have all the money saved up in the world, but if you don't have your health, or you're dead, you can't enjoy it. So invest in what's your best investment, and you don't have to put all of it in once. Just make small deposits. Go for a 5-minute walk, ching, right? Eat one extra vegetable, cha-ching, like every little thing. Think about it as putting money into this investment that you want to enjoy in your golden years when you can actually thrive. And again, I just say it, sometimes it depends on how much time I have, but I find like people can sometimes vibe with that analogy. So, but if they just want a pill, it's okay. Like, it's always their option. We can't force a patient to make a change, but we do still need to offer them lifestyle as an option. And if they say, and I love it too, this is another line that I have in my back pocket when a patient's like, oh doc, YOLO, right? You only live once. I just want to, eat what I want now, and then I'm going to drop dead of a heart attack. That's fine. And I said, I hope so. I say, because you hope you're going to drop dead with a heart attack. That's what everybody wants. But I'll tell you right now, conventional medicine is really, really good at keeping you alive. So what'll happen is you'll have a heart attack. You may come back with some deficit or a stroke. You may come back because medicine will save your life in a pinch, and then you might be disabled. And then you've got a fistful of pills living in your body that you can't control. I'm not trying to scare you. I'm trying to be honest that people think they're going to drop dead. They don't always. So just want you to think about that. That's all. And I try to have it as a conversation. Maybe I sound preachy. I don't know. I don't think so. It's been well received in some patients because then they think about it. And if they still want a pill, thank God we have conventional medicine, because that's how we manage. The last point is, if you want to present it another way, if you're trying to convince them, if you're taking that long to convince them, it's not like, let them just sit with it. It's okay. But you can tell them, I'm not looking for a lifetime commitment. Just, could you try it for 2 weeks? Could you commit to 2 weeks and see what happens? And sometimes they get buy-in. And then patients who just aren't interested, again, like roll with the resistance. If absolutely like they're shut down, it's okay. Stop. It's okay. End the conversation. You've done your due diligence, and you just, again, non-judgment. It sounds like it's just not the right time, right? I have a whole lot of phrases in that roll with resistance handout that I gave you. You could offer them. Would you like a written resource to just on your own time read more about this? But like if they shut it down, you shut it down. Our job is to give the treatment options and then just allow the patient to make the choice, because just like when we prescribe pills, we don't know that they're actually taking them. We have to do the same with lifestyle. So it's okay. If they're not interested, you've done your part. I did talk about this a bit as well. Did I mention everything? Oh, I didn't mention this. I thought this was brilliant when I came across it. It's the 5-2-1-0 rule for both obesity and diabetes. So just say, okay, you want a small goal. Could we aim for 5 fruits and vegetables per day? Could we aim for 2 or less hours of screen time per day? Could we aim for 1 or more hours of activity? Any activity, as long as they're outside doing something that keeps them a little breathless. And then 0 SSBs is sugar sweetened beverages. I think if everybody just got rid of sugar sweetened beverages, we would see a whole lot less problems in our chronic disease world. And then I mentioned Dr. Patel. Someone started to get more specific. Some people ask more specific questions about supplementations. This is a really that's why my slide is so long. There's a lot of nuance to this. For me, I always keep in mind nutrients should come from your food first and foremost. Whenever you can get it from whole foods, it's always best. It's the way nature absorbed it. It's the way nature intended it for us. And because this food supplement industry is not regulated like our drug industry. So you could be thinking you're paying for vitamin whatever, and what's in it is sawdust and maybe like a sprinkle of that actual vitamin. So there's zero regulation. You have no idea. So if you are going to choose a supplement, if your patient's going to choose a supplement, I would be speaking to someone who knows about, so maybe you talk to a pharmacist, possibly even a naturopath who deals with, like, who works with supplements a bit more to understand, like, which ones are higher quality. So when it comes, though, to certain nutrients, I just thought it's important to be aware of these ones, in particular, vitamin D. In this part of the world, I almost think everybody and their sister are vitamin D deficient. Like we have a suffrage of vitamin D deficiency, and we don't know about it because it's not formally tested. I am very liberal in offering. I know they have to pay for it. I don't, unless they have osteoporosis. Like there are some instances where you can have it covered, and those are the people you do need to be testing it for sure. Like our patients with GI issues, bariatric surgery patients. Crohn's or colitis, I think inflammatory bowel disease also counts as one of the OHIP covered, but I even offer it. It's about, I don't know, $60 or $70. Not everybody can afford it. I understand that, but I would recommend everybody be tested because the number of times I was vitamin D deficient, and looking back, I know why. I assumed I was getting enough because I'm outside a whole lot. I take my supplements, but I often forget because I don't remember. And I was deficient. I was shocked. And that's not early on. That's like recently. So it just prompted me to start taking my supplement, and I have to get now retested. But vitamin D deficiency is it leads to a lot of issues. We don't need to go over that with you. And so I recommend, for teens, at least 800 international units, 400 for children. And then for adults, I'm recommending at least, I know the guidelines sometimes say 1,000, but I say if it's in the winter time, I like to have a baseline. If they're normal, then in the wintertime, I would do 2,000 a day. In the summer, go down to the 1,000 a day. If they're not eating foods that are fortified in vitamin D. And if they're elderly, I'm recommending 2 to 4. And I would usually offer, if they can afford it, to do a baseline screening, because the number of patients in the elderly population who are vitamin D deficient is alarming. And so vitamin D is one that I do recommend because it is hard to get a supplement. Like it is hard to get in your diet alone. B12 is also a vitamin that even omnivores are now deficient in, because of factory farming. We are not like the cows are supposedly injected in the chickens with vitamin B12 so that when their meat is actually vitamin B enough or sufficient, but because they're not grass-fed and getting the vitamin B12 through their gut microbiota, because of antibiotics being used and sprays being used to kill off the bacteria in the soil, we're seeing a lot more vitamin B deficiency. So I definitely, in anybody who's strictly 100% plant-based, they need to have their B12 checked at least once a year. Older adults should have their vitamin B12 checked because, again, the risk versus benefit is great. Like it'll surprise you how if you start screening for it more regularly. I started screening women in pregnancy because that was also very shocking to me in my family practice, how many people would be deficient, which can affect their fetus. And then obviously the normal, the usual suspects, bariatric surgery patients, inflammatory bowel disease, celiac patients should automatically be screened and supplemented depending on where their levels are at. If they're deficient, they need a higher dose. If they have obviously issues with absorption, they may need the IM dose, but the dose is very, for the general, say, plant-based person, I recommend 1,000 micro, and say they have a normal level for maintenance, I say about 1,000 micrograms, like 3 times a week at most. You don't need a whole lot. You just need a little. I think it's 20 micrograms every day, but there's no such thing as a supplement that offers that. Omega-3 has like, again, try to get it with diet and so fatty fish 1 to 3 times a week, ideally organic, ideally, not bathed in mercury because that's the issue, and pesticides, and not farmed. Fatty fish is the best way to get it. But if you're going to supplement to maintain your levels, and there are tests you can order for these, since they're private tests, 200 to 300 milligrams per day is good for maintenance. I know some studies show that 1 gram a day offers cardiovascular protection, although super high doses actually increase your risk of AFib and bleeding. So I'm not one to push omega-3s. I usually recommend algae sourced, just environmental purposes. And for people who are strict vegans, I would recommend a supplement of 200 to 300 milligrams per day. But remember that when it comes to omega-3, it's the ratio of omega-3 to 6 that matters. So another way to boost your omega-3 is lowering your omega-6 fatty acid consumption, which is often found in those oils that are used in processed foods. So those processed seed oils, and then bumping up things like olive oil, and then thinking about chia, flax, hemp seeds. The reason why some people shy away from that as the only source other than fish is the conversion has to happen. And there are some people who genetically don't convert ALA to EPA and DHA. And so we don't know who's who. I guess you could have testing for that too, but then, slippery slope. But there's nothing wrong with saying to everybody, like, hey, if you want to boost your omega-3s and you don't want to take a supplement, a tablespoon of chia, hemp, and flax every day, you should get enough, unless you're genetically predispositioned or you don't have the conversion, you should have enough. And then lowering those processed foods will make that ratio where it wants to be. You want 1 omega-3 to 4 omega-6. To get 1 to 1 is nearly impossible just because omega-6 is just much more prevalent. Calcium, I only recommend if their dietary sources are inadequate, and never above 500 milligrams per day. But food first is really key. And I think there's a question about that. So we'll talk about that, put a plug in that one. And then iron deficiency, we need to be aware of in primary care a little bit more. We need to be screening women in particular for iron deficiency. They are tired, they have brain fog, they're losing their hair, they have low libido, they're cold intolerance, they have restless legs. Even if their hemoglobin is normal, and I've just came across this information and had a personal experience with it. Even if their hemoglobin is normal, if their ferritin is less than 30, they should be supplemented. Ideal, like there's normal and then there's optimal. For optimal brain functioning and metabolic mitochondrial functioning, our ferritin, our store should be at least above 50. 50 to 70 is optimal. And there's new evidence coming out to suggest this. And so it's not, if you, as one specialist told me, if you have iron deficiency and a low ferritin, if your hemoglobin is low, that's end stage iron deficiency. If your normal hemoglobin and your ferritin is low, your mitochondria are starving, and that's why you're tired. And when you get person back up to level, you watch their symptoms turn around. It is like magic, especially for women, because they're losing blood every month. So I do. And then when it comes to supplementation, that's the problem, right? Is like a lot of women can't, or men, people can't tolerate the GI side effects. There is a new formulation coming out. It's just being released in this month. It's called Ciderol. It's been in Europe for a number of years. It's sucrosomial iron. It bypasses the GI tract. It's much more highly absorbable, almost equivalent to an iron infusion. And it has like very negligible GI side effects. So increased absorbability. It is more expensive. It's about $56 or $57. Right now, pharmacies in the GTA are offering it, but you can order it online, free shipping. And it is about $57 American, but 1 month's worth is like 3 months of oral iron, the regular oral iron without GI side effects. So I learned about this most recently. I went to a talk and I've spoken to some physicians who are kind of in this iron space, again, because I had a personal issue with iron deficiency, and it has dramatically changed my life. And also consider if a patient is, anemic and low iron, and they have ongoing blood loss, for example, like a woman, consider iron infusions a little more liberally with your patients, because it can make a dramatic difference in their quality of life.
Amanda, just as before you move on, there was a question in the chat on the supplement talk about IV therapy for supplements. Do you recommend that, or do you recommend the other?
I mean, I don't know the evidence on that. I wasn't trained in functional medicine. I was trained in lifestyle medicine. So, no, I don't routinely offer, except for IV iron in that specific situation. I would have no hesitation in ordering that, just because, even in a patient who has normal hemoglobin, but if their ferritin is progressively less than 10 and they can't tolerate and they're exhausted and they have restless legs and they have brain fog, please offer them an iron infusion. I know maybe choose wisely would shoot me for this, but honestly, the dramatic difference it can make in that person's life is like night and day, repeatedly. So.
Thanks. You're about 7 minutes left.
Okay. Dairy. I know it kind of came up subtly. People were wondering oh, do you not recommend dairy? What's the deal with it? And then the whole question of well, if they're not having dairy, then how do they get enough calcium? So my stance on dairy has changed over the years. And if you look at bodies like the ACLM or PCRM is another one I didn't mention, Physicians Committee for Responsible Medicine, another great website for patient information and kickstart guides. But they take a very solid stance that they recommend dairy is just not, the health benefits are the risks outweigh the benefits. In my mind, I don't think dairy itself is necessarily the issue in our society. It's just how much we're consuming and what kind we are consuming. And if you look at Canada's food guide, I always go back to what does Canada's food guide say? And Canada's food guide no longer recommends cups and cups of milk. Let me rephrase that. No longer recommends cups and cups of the breast milk of another species. We are the only species on the planet to continue drinking breast milk into adulthood and to continue drinking the breast milk, not only of our own species, but of another species that's entirely different. And if we expect, and if we did that, and we did that for a good reason, back when we were calorie deficient post-war, it was a savior for us because we didn't have protein, but we are in calorie and protein and nutrient excess right now. And dairy's kind of come alongside as the good guy, which is a huge industry marketing that. And so Canada's food guide, looking at the evidence without any industry funding, says, listen, water should be your drink of choice. You don't need a cup of milk with every meal. And if you're going to consume dairy, it falls in that protein section, and that protein, it should be a small serving. And when we look at studies, there are some studies to support health, cardiovascular health, and even some cancer prevention in terms of bowel cancer health. You got to look at who funds it, because there's usually Danone is in there somewhere, dairy farmers sometimes. But industry funding is not necessarily a bad thing necessarily, but the doses by which it showed effect were like 1 to 2 servings, not more than that. To date, there is no evidence to suggest more than, in fact, there is some evidence to suggest if you increase the doses, you get a neutral effect, but nobody's looking at how much we're actually consuming. And we are consuming a whole lot. And I did pull up stats, and I don't think I can pull them out of my head right now, but we are consuming like pounds and pounds and pounds of dairy per year. And the problem is we're not choosing the kind that the studies have shown are beneficial, low fat, fermented. So we want to consume small amounts. And the other issue is IGF-1, insulin growth like factor 1. It's a growth factor in our bodies that when we dump a whole lot of specifically animal protein and specifically dairy, we actually produce in our liver IGF-1, and IGF-1 promotes cell growth and reproduction, not just normal cells, but abnormal cells. And there are receptors on pretty near every cancer cell for IGF-1 to target to increase their growth. So, there have been, especially if you have a person of high risk of prostate cancer, there's definite randomized control trial evidence to suggest they should not be consuming dairy because of the IGF-1 factor in triggering their cancer growth. So I usually say, if you're going to consume dairy, have it because you like it, not because you need it. We can survive as a population without any dairy in our diet, but if you like it, but have it in small amounts. And the ideal forms are low fat. So you want to avoid butter, cream, full fat milk and yogurt and cheese in large amounts, right? A serving size of cheese is 1 ounce. Do you know what 1 ounce is? And patients are shocked. Like one serving is 2 dice-sized cubes. I don't know about you, but like if I'm in front of a cheese platter, I am not eating 1 or 2 dice-sized cubes. There's like, it's so addictive, right? It's the perfect combination of sugar, salt, and fat. Sugars being the sugar, the milk sugars, but salt and fat in particular, it hits our dopamine centers. People just love cheese. And it was the last thing that I had to train myself to give up. I mean, I'm Italian, like we used to make cheese in our basement. So anyhow, so you want to keep it. So fermented food in general is amazing for your microbiome, but fermented yogurt has the most evidence in terms of protection. So fermented dairy is what I would recommend. So yogurt and kefir, ideally unsweetened. Again, you don't want the ones with added sweeteners. Get the unsweetened plain and tell them, cut up some bananas, blend some dates and mix it in there. Put a little bit of honey if you need it, or maple syrup. Put some berries in there, pomegranate seeds, add some oats, make them muesli, some raisins, but use unsweetened ideally. And then somebody asked along the same lines about these plant-based butters. Yeah, no, like they have palm oil and coconut oil, and they have saturated fats, and these are the same saturated fats in large amounts as butter does, which affect our cholesterol and contributes to cardiovascular disease. So in terms of how much calcium, I'm not a dietitian, but I did some digging when I was learning about calcium, and like our recommended doses are 1,000 to 1,200 milligrams per day on average. But that's total calcium. We actually need what we need, and they've made this recommendation based on the fact that we are, eating a mixed Western diet, and the foods that we're consuming have an average bioavailability of only 25 to 35%. So they give you 1,000 milligrams per day, knowing that what you actually need to sustain health is 300 to 400 milligrams of calcium. So you still need the 1,000 if you're choosing foods that have a lower availability. And I will email you a list of foods that are highest bioavailable you're consuming is actually absorbed, versus some of our plant-based sources, specifically some leafy greens, the low oxalate. So things, low oxalate greens like forget spinach. Spinach is high in oxalate. Sorry, kale, bok choy, broccoli. Those have a 50 to 60% absorption rate. That's the highest you can get in the spectrum. So making sure that, again, and they also have the added benefit. You're adding fiber, you're adding other phytonutrients. These are ways to get calcium that aren't going to risk you getting too much saturated fat in your diet, for example. So an example, I listed an example meal plan, and I will send some more information kind of in handouts because I know that that's a common question. And mostly it's because of bone density, but you need to keep in mind also that the most important factor for your patient is actually weight-bearing exercises, lifting weights, lifting long, lifting heavy if you can, walking. Weight-bearing is the most important. The second is vitamin D. Calcium is third on the list. And then protein is enough. So if they're low in protein, you want to actually make sure they're getting adequate amounts of protein. And that doesn't mean more meat necessarily, but more total sources of protein from all different sources, including plant-based sources. How am I doing for time, Michelle?
Awesome. We are actually out of time.
Oh, good, because I just
suppose
talked about key group sessions, which I already talked about. So I think that was all my questions. Yes, that's it. I'm done. Oh, no. Yes, I'm done. I did it. Whew.
Woo, you did it. We did it. Amazing. Well, Amanda, that was incredible, and I'm sure that people start as they consume the information, start to leave with more questions. But we can make sure that we provide the resources that you have mentioned today. And I do have my free account set up for the ACLM now, so I can go through, you know, as we discussed at the symposium. The symposium recording of your talk is now going to be made available shortly. We will put that up on the MLPCN website for anybody that didn't have the opportunity to hear the first part of Amanda's talk about lifestyle medicine. And then this recording, of course, will be available to everyone. But if you're still on the call and you haven't run back to a patient, just maybe put your camera on for a second and everybody just say thank you and say goodbye to Dr. Marrone. And thank you so much for such a wonderful, wonderful, energizing talk. Yeah, there's Tara. I see Tara. Hi. and Julie Clark, Dr. Clark, Karen Cunningham. Yeah, wonderful. So thank you so much, everyone.
Fantastic.
And you will get your main pro credit for this if you're a practicing family physician. So thank you so much for your engagement and interest and for joining us today.
Thanks for having me. And I will send again the slides from today and then a few more handouts that I've kind of came up with along the way just to help you along your journey. And if you have any questions, like Michelle has my email, just reach out. I'm always happy to assist in any way I can. I truly value that you've taken your time. That's super precious in your extremely busy schedules to learn how to empower your patients, because that's a key. And I love it. Thank you so much.
Thank you. Thanks, everyone. Have a great day.